recorder is now
recording. All right. So this is the Tuesday, November 12th meeting of the Council Operations Committee. Present are myself, Councilmember Conti, Chair, and committee members, Council members Hoey and Anani, and Councilmember Flynn, not a member, but here. And also City Clerk Danielle Gillespie. Purpose of the meeting is to consider two ordinances, 32.101.19 in relation to fees for certificate of marriage, and ordinance 34.101.19 in relation to fees for birth and death certificates. So let's go to 32.101.19. Is that the right one? Yes. Okay, so this will do two things. Is this the one? Yeah, okay. So this provides for... Well, Danielle, why don't you go ahead, because this is your stuff in both cases.
So it will do two things. One, one, it will allow us to correct the fees that are incorrectly listed. I think section 245, 9 or 10, which states the cost for a certified copy of a marriage record is $15. We're required by state statute to only charge $10. So that's the second piece. But the first piece and the most important piece is the governor signed into law the ability for the state to waive their fee that they charge active duty military in the application process for a license. So we basically want to mirror and commemorate what the governor's doing by enacting legislation that would allow us to waive the city portion of the fee. And it just kind of honors those veterans, those active duty military that, you know, put their life on the line for their country. So.
Okay. Any questions?
Yeah, I just want to, commend the governor and also commend you also for definitely looking into this. Again, this is about honoring and appreciating the men and women who have sacrificed. We owe a debt, a great amount of debt to the veterans, and I think that this is just a small token of our appreciation as a city. We have waived the civil service exam fee application as relates to jobs, and we've seen an increase. And I believe that this is also going to be a step in the right direction. And I want to commend everyone that was involved in coming up with this legislation.
Any other discussion?
No, I agree with Chief. And
okay. Is there a motion?
I'm moving out of committee and with an affirmative.
Okay.
Recommendation. Second.
Motion by Mr. Hoey, second by Mr. Anani. Any further discussion? Hearing none, all in favor, aye.
Aye.
Motion is adopted, and so that is reported out.
Unanimous?
With the unanimous recommendation. The second resolution is ordinance is 34.101.19. This is an ordinance related to birth and death records. This one I'm familiar with, actually.
Yeah.
So right now, state law regulates what localities can charge for issuance of birth and death records, or certificates of birth and death, which is $10, and that was set back in 1991. There was a bill passed this year that allows City of Albany to increase its fee to an amount up to what the state health department is allowed to charge, and their fee has been increased several times since 1991. So currently, the state health department can charge $30. Yeah. There are only a couple of localities that got this special provision. We're one of them. And so this ordinance would increase our fee from $10 to $15. So it's a $5 increase.
Mm-hmm.
Okay, that's a good deal considering if you go to the Department of Health, it's $31.
Yeah.
So the
30.
Department of Health
30.
And the way way they get you, well, I shouldn't, for the record, say the way that they get you, but it becomes very expensive if you go to the Department of Health and expect same-day service, because they're charging you $30 for the certificate and then an additional $15 to get same-day service. So you're
So it's
paying
$45.
$45 per record, and they've limited the window of offerings. You can only come in person between 10 and 2 now and pay $45, so a premium, basically paying like 3 times what
Right.
the city charges.
I recently had to, last year, I had to get a certificate of birth record, but I had to go down to get to the New York City department because I was born down there, and the two departments are separate the way it's handled. So I have to go down there. I had to do it through mail and expedite it and everything else. But
Yeah, I had to get my parents. They got married in New York, and it was like $45 or $50.
yeah, I needed it for my passport, and I only had a photostat, which was not acceptable, so I had to get the reused.
The real,
certificate,
yeah.
So that's what this would do. This would.
acknowledge-
hi,
Why,
and I
why are
want to
we only
acknowledge-
increasing it by $5?
Whoa, Judy.
Because I think, for me, this is a barometer. You can always go back in and make an adjustment to the legislation and do additional increases. You don't want to run out of the gate and price it too high, because there'll be a lot of complaints that come before the council and the mayor's office. $5 is a minimal amount, and it will not hurt the constituents that much, or the funeral homes that do business in the city of Albany, because people die in the city of Albany and have to come in and get certificates. So $5 seemed reasonable.
I have a question, and I've expressed.
Did you have a?
They need a marriage certificate, the funeral?
No, they need birth and death records.
Yeah, this is just birth and death.
Yes.
Even though, I mean,
So it's birth and death.
the article is certificates of marriage, but this relates to birth and death certificates.
We already passed
Oh,
the
I'm sorry,
first
No.
one.
you're on the
This
second
one, the
one.
second one, yeah.
Okay,
The first one we already did.
all right.
Okay. And I just want to note that Councilmember Duche is here, who was a committee member. So, all right, Elisa?
Yeah, I have a serious concern about this increase. Very too often, when I speak to some of my neighbors, they always say City Hall is always trying to nickel and dime them. And the justification, I understand, but, when you look at other municipalities that are on here that have a higher increase, I don't believe that they face some of the challenges that the residents of the city of Albany faces. When you look at our median income here in the city, and so many of the population are working poor, and I just don't believe that increasing this be needed to balance the budget.
Well, it's not.
I understand why, but it's just something that I don't feel comfortable right now at this moment supporting, even if it's a $5 increase. But I am willing to compromise. I've spoken to the budget office about this as it relates to the revenue. If we're able, we can, and some of the compromise that were made is that if we do make this increase, there's a possibility that we could determine as a council where we want this money to go. But right now, I don't see myself
Well,
supporting this.
the
this
budget does
platform.
not assume any revenue from this increase. So
Where does the revenue
it
go?
goes into the general fund. It's not accounted for in the proposed budget as far as additional revenues, but it's something that could be used to help with some of the issues in the clerk and the vital statistics office.
Yeah, and I did speak to the budget director as it relates to this.
I know there's a lot of side conversations about the budget that goes on.
Yeah.
What? I'm sorry?
Nothing.
I did speak to the
Just an
budget.
observation.
I did speak to the budget director about this specific legislation. I'm not in favor of passing this unless I know that we are going to make a difference with the revenue. And something that I would like to see, especially all of us, we keep talking about senior services. Maybe we could put some of this revenue towards helping seniors in the city of Albany. But right now, I don't see myself supporting this
Maybe we can
legislation.
help our underpaid clerks too.
That's another option.
Anyway,
so
Can I
Yes.
offer?
yes, go
So,
ahead.
Some of that increase supports the cost of doing business. We print out certified transcripts, so we print out the actual transcript, which the paper costs about $3,000, right? Just to get the paper, because it has to have security features, and the state dictates the types of security features that have to appear on that type of paper. That paper is extremely expensive. Another cost is our seal. We have an electric seal because my concern was repetitive workplace stress injuries, and they had a manual seal, but because the city of Albany does about 5,000 births annually and about almost 3,000 deaths annually, you're looking at 8,000 certificates at minimum that you have to create. And if you do a handheld seal, there's a chance of workplace compensation issues being claimed and repetitive injuries because it's a repetitive motion. That seal alone costs $5,000. So, and we have to periodically maintenance the seal. And then we need an additional microfilm reader. Those microfilm readers cost about $15,000. So there's a certain cost of doing business. So yes, there will be some additional revenues, but I also have to look at replacing a machine. And this year we added an additional staff member to that department, so we are more efficient than we have been in past years with our ability to be responsive to the constituents. So it's not just an increase for the sake of an increase, but some of that increase, there's a direct cost of doing business.
Have you spoken, well, I'm here, two things.
Just want to touch on, in terms of affordability, if an individual is not able to afford.
So, and then there's also in the statute that governs the issuance of birth and death records, the state dictates when we are required to waive the fee. And then the state gives me personal latitude. So there have been situations where, as a city, we've waived fees because there were blocks that there were fires and the people lost everything. If they lived in that block, we waived the fee. If the certificate is in connection to an application for public relief, food stamps, or just general public assistance, we waive the fee. If the birth certificate is needed for school enrollment, for pre-K and K, we waive the fee. So we have a lot of latitude to waive the fee so we don't unduly burden citizens.
Let me also just make another note. Because of the number of hospitals, major hospitals that we have here, we're not just talking about City of Albany residents.
No.
Because everybody who's born, whether you're in Colony or Bethel, if you're born in the City of Albany, we're the ones that issue the certificates of birth, or if you die in one of our hospitals, or nursing home, the certificates of death are issued here. So it goes way beyond.
I just have a question. I just have a question for the clerk.
It's a small amount.
As it relates to the revenue, it's stated that it's going to go to the general fund, if I'm correct. Have you spoken to the budget office to some of the things that you would like to see from your office, this revenue?
Well, I did, when we did our budget presentation, I did talk about some improvements I'd like to make. Just recently, one of our microfilm readers have not been performing to the level that we needed to perform, so that we're able to provide this valuable service to the City of Albany residents and people who are born or die, family members. So just recently, I have discovered that I may need to replace a microfilm reader, and they're very expensive. I try and purchase refurbished machines only because
my question is, have you spoken to the budget director as it relates to this revenue going towards your office?
Yes, we have conversations.
And he has said, is there anything that you could share?
There was nothing specific about replacing the microfilm reader because that just became an issue after we had to submit our budgets. But I have to say that the budget office has been very responsive because they realize that I'm a good steward of taxpayer dollars and I don't ask for things that I really, really don't need. So they have been very responsive to me when I've come and asked for things, if that answers your question.
Now, if there was a situation where somebody needs a death certificate and they don't have the money, does the city have any kind of safety net for those people?
I have a discretionary ability and I can waive the fee. So if it's a hardship case, we definitely have waived fees.
Okay. And they just come to the clerk's office and just ask.
You would waive that even if it's for somebody outside the City of Albany?
Yes. Because by state law, If they need a birth certificate to enroll in preschool or kindergarten, I have to waive the fee. If the application is connected to a food stamp application, then I have to waive the fee. We do ask for documentation, which we will attach to the application to make it seem like, we're not just waiving fees for the sake of waiving fees.
Yep.
But, yeah.
So, this is a $5 increase, and what happened with the first proposal, the marriage one?
It passed.
When that
It
passed.
Passed out of committee?
Yeah. Unanimous, yeah.
All right. So I don't quite understand why the $5 fee there would be appropriate and this $5 increase is not.
But wait a
And
second.
I know
Hold.
what Mike has said, and he has said it to me, and I gotta say, it's pretty bizarre that you're gonna connect this additional revenue, basically, it's like holding additional services for seniors hostage unless we pass this.
He didn't say that. He said he's open to it. I don't know if you said you had a conversation with him, but he said he would be open to it. Me personally, I believe that it goes to over the past couple of months, walking around the neighborhood, talking to them, they feel like City Hall, year in and year out, are nickel and diming them, whether it's a trash fee, whether it's this fee or this small increase. And people are paying attention, even the towing increase. People are paying attention. And I just don't feel comfortable increasing any fees on any of these city services. Is just I just don't feel comfortable. Even if this is what, a 50% increase?
Yeah, it is. This is a state the state basically regulates what we can charge.
I just can't.
And we only were able to do this because of a special bill we got through, but it hasn't been increased since 1991.
And I think that's what you got to look
So
at.
again, we're
That's
talking
28
about,
years.
we're offering a service currently for $10 that if somebody goes to the state, they're paying how much?
$45 if they want to walk out with it the same day.
So we are providing that service. People could go there. We are actually providing people with a discount. And then when it comes to
I just look at the median income in the city of Albany and the unemployment rate that exists here in the city.
she's saying that she waives things for hardship
So folks from
cases.
Loudonville can come here and instead of paying $45, they
Can get it for 10.
Yeah.
And Bethlehem, and the other thing is we look at the addresses of the people because the state form requires that the applicant provide their name and address. A lot of the requests are people that don't even live in the city of Albany.
So
you
can we
have people-
increase it for them instead of?
No.
You cannot.
How many of the 8 that you said 5 and 3,000?
Say that again?
You said there was 5,000 births and 3,000 this?
Yes.
And how many would you say are city residents? Half? Educated guess? Not even?
That's very difficult
Well,
because
no, I'm sorry.
it trends.
I know if you had a spreadsheet of
if I had a spreadsheet, but it just kind of sort of
I'm
trends
just trying to
both
say
ways.
most of the people may not even be from the city of Albany that are getting these.
No, most of the births and
Most of the people aren't even residents that even live in the city of Albany.
Yeah.
Right.
And we do a lot of requests for
That's
people
my
that
argument.
live
So
out of
his
state
argument
too.
of hardship to the residents is new because a lot of them are already
This is just
residents. Some of them are from Loudonville, which is a higher medium income.
Colony, Ravenna, Glenmont,
Yeah.
Schenectady, it's all over the Capital District area.
I would like that. I mean,
And then there are emergency cases.
if there's a possibility that the budget director could make a commitment that this revenue is going to go to something that we could
Well,
all, I
pay
feel
for other
comfortable.
things.
That's not true. It's going to the general funds. We don't
That's
know
where
where
it
it's
has
going.
to go to the general
Okay,
fund. Everything goes to the general
I understand that, but again, the budget director has had a conversation, and he said he's open to allocating this revenue towards something that we are concerned about, which is senior services or issues in the clerk's office. If I could get a commitment from him saying that where it's going, I'll be a little bit more open and comfortable with supporting this. But as right now, I just don't see myself supporting this increase.
So unfortunately, I missed my own committee meeting due to fairly sick for when recreation came in. The mayor's budget message already says that we're increasing services for seniors. Did Jonathan Jones talk about that? Because that was one of the questions I would have asked. Is like, how are we going about increasing?
And what does it look like?
And frankly, Mike and I, went to meet with the entity that gets the $26,000 currently under contract. And I was a little surprised at how there's no real coordination of senior services. And so what we really need to be doing is having the department rep or the administration in some way figure out a way to actually coordinate services amongst the different agencies, publicize them, so we have, the NORC providing services, we have, what's the name of the Senior Citizens of Albany, what's now it's called?
Whatever it's called.
Yeah. Recreation Department provides some, but in any case, I'm very confused by Mike essentially saying, well, if you guys want to spend some more money, when the mayor is basically saying we have increased services for seniors, and I don't see it in the budget.
I don't see the, yeah.
Well,
I don't see it in the budget, but it's in her press release.
But let's just speculate. Fees for services, we have fees, they're meant to support the programs that those fees are for, and you're not supposed to use fees to generate revenue for other purposes outside that program. So the revenue generated from these fees appropriately will go into supporting the Office of Vital Statistics and the clerk's office, because they are now one, basically, for the services that they provide. So that's where those revenues are supposed to go.
I agree that's where it's supposed to go, but that's not where it is going to go.
But
I don't see any
everything goes
commitment
into the general fund, yes, because that's the way it's required to go there.
We can have a paper trail though, right, Richard?
Yeah.
Can we,
Sure you can.
we can make sure that, right? I'm asking, can we
Well,
make
really,
sure-
technically, they're not supposed to, for anything that they're charging a fee for, they are supposed to keep an accurate record to make sure that the fees that they are receiving do not exceed the cost of providing that service. Otherwise, it becomes what is known as a tax, when you go above and beyond what the actual costs are. Now, I look at this and I'm like, well, if we're talking maybe $30,000, $40,000 a year between having the clerk, having the materials, having, overhead for the office, etc., I don't
The paper,
have a question.
the seals.
I don't have a question that even at,
The microfiche, yeah.
50.
I just want to make sure we get what we deserve, for doing this work.
And I could track, because I can look at a progression of revenues. Like I can tell you at the conclusion of a year how much our revenues have increased, but it's difficult for me to determine if they've increased as a result of the $5 sometimes, or if we've had so many people die that people are requesting a lot of death certificates. But I can kind of give you a snapshot next year, and then you can see the difference, but this maybe $5 increase may.
Could we decrease next year if it turns out that we're taking in more than what we should be?
But if
so
we
it's not-
decrease, that may mean that I have to eliminate a position.
Okay.
Or it may mean that I have to...
you're saying to eliminate a position. How much revenue do you think we're going to receive on a yearly basis if this was to pass?
Over,
40,000
like,
times five.
in past years, the fees have gone up like $30,000 since I've been, well, not the fees, but the revenue attributed has gone up $30,000 since I've been here, because people are requesting certified copies a lot. And this
That's not just death and
it's just
birth.
It's birth and death. I've seen a fee go up $30,000
Hospice.
because people have been
Because
requesting.
you basically said, I think you gave us a figure that was basically a total of 8,000.
Yes,
Yeah.
but that's the number of deaths that we are filing, but we're filing deaths and births as they occur, but then you have another base of customers that are requesting certified copies of events that have already been filed.
Okay.
And the demand...
I'm sorry, I thought those numbers were
Oh, yeah.
what you were actually
No.
issuing away.
That's
as
what I thought.
certificates.
Yeah, I thought the same.
Yeah, I did too.
No.
Okay.
And the number of certificates being requested has gone up, which has put a tax on the staff in the department, because now in order to renew your driver's license, you have to bring a certified copy of your birth record. A lot of people don't have that, so they're contacting us, and they're contacting us by phone, they're contacting us by mail, and I had to increase and add an additional staff member just to manage the volume. And some of her salary can be offset so that I can keep that position open.
So you say it's gone up by 30,000. How much do we have in the budget for
I think I was very conservative in the budget and maybe budgeted 274,000. 274.5 may have been what I attributed to vital statistic fees.
Which doesn't include this.
Which,
Right.
yeah.
So I just want to, when we talk about the costs of generating the certificates, you can't generate the certificates unless you have them on file and you retrieve them, etc. So it's the entire filing system and the cost of maintaining that entire office, because it exists so that people can get copies of these documents. So while that's a bigger amount than I thought we were talking about, I still have a hard time believing that we can't show that it's costing us that much.
And most of the revenues, our department, because our department is one of those self-funding departments, our revenues cover basically the cost of our salaries, supplies and materials. And there's certain license agreements that we have, because we provide, we store the images digitally. So there's an annual fee associated with that. We have service contracts with the microfilm reader, and that's under warranty. So then we have supplies and materials that we have to order. So we're one of those self-funding departments, and most of the revenue goes towards salaries, supplies, and materials. So the city only really sees like a net 30 when you look at all of the expenses of the department and all of the revenues of the department.
You also have photocopy machines?
We have photocopy machines. We have to order paper, regular plain paper.
Well, just giving the photocopy is an expensive business, I know that.
Yeah. I mean, I'm just really concerned about these increases, these small fees coming out of nowhere, and
This
the
is not coming
residents.
out of nowhere.
Do we need it to balance the budget? That's essentially what my decision is based on. Do we need it to balance the budget? And if it's no, then I'll be voted no.
Okay,
It's
fine.
just ridiculous.
It's not being used to balance the budget. It is being used to offset costs within the clerk's office and provides an opportunity for further investments.
This is just some
The demand has gone up, Chief. That's what she's saying. We haven't increased anything since '91. Now people are going to go to the Department of Health and find out they're 45. Oh, I can go to the city and get it cheaper?
15?
That's going to even increase it more. So I see it.
I mean, that's what's happening already. That's
Just to make
current
news and
already.
give more revenue.
Yeah.
Or
But
it
it's
could make
more work
news
for
and
us.
a lot of calls about these fees increasing. So I mean,
There are also more state mandates, I guess, now in terms of when people need their certificates than
Then there
there
have been in
So
past
that does
years.
drive.
Especially
After
with the
September
enhanced
11th.
license.
Yep. And then
me personally, I'd like to see some type of commitment with this revenue. It's just, I understand that this most likely is going to go to staff. There's nothing in writing that's saying that it's going to go to staff. This could go, for all you know, to the Skyway project. You don't know. You just don't know, and I just don't feel.
Well, it can only go to the Skyway project if we authorize any funding for the Skyway project. There's
That was just
nothing
one
in the
example. I
budget.
just don't believe that we do not need this.
Well, we
increase
added
to
somebody
balance
to
the
the,
budget.
we added somebody to the clerk's office. And that, what you said to me, if we lower it next year, you might have to let that person
I could
go.
potentially, yes.
We're not lowering this. We could just
Or
stay
if
as current
If
form.
we keep it status quo, the budget office may come back to me and say that I can't afford to keep that position. I don't know.
I'm concerned about that.
And I'm concerned that the budget director is doing that type of intimidation as it relates to staffers. Like, if we don't pass this, we're going to eliminate a position. That is ridiculous. That is,
We don't-
you
that's
cannot.
not pass this, we won't get
But I
it.
don't. This is
two
more of a
together.
reason why I don't support it. Like, you cannot do that. You cannot do that as a budget director to come in. Oh, we're going to eliminate.
That's not what she said. That's not what he said.
Okay, well, that's the way I feel. That's
Can
what
I
is being interpreted to me.
share one
That
other
if we don't
thing?
pass this, then there's an opportunity that somebody in the clerk office is going to have to resign. or be fired?
No, what she said was because the revenues support program, departmental operations, if we don't have the revenues to support those operations,
I
next
may
year the
have
budget
to
director
be
might
more
say
conservative
we
in
need
staffing.
reductions. The direct,
The other
I wish
thing,
we had the budget director, somebody from the
Can
budget
I
office
share
about
this with you? So
I'm
when-
really uncomfortable with this.
when I came on board as the director of vital statistics, I did a poll and I reached out to Troy and I reached out to Schenectady, and they all felt crippled and handcuffed by the state and their inability to raise the fees. If the former city clerk in Schenectady had been working with his legislator and his senator trying to see what he could do to just allow this language to be written in law so that the different municipalities had that flexibility. So I just want to share that with you. And I know Troy feels handcuffed. I know Schenectady feels handcuffed. And any other municipality that issues birth and death records, because they basically have to provide a service for which they have no voice on how much that service costs.
Yeah, Troy and Schenectady cannot do this because they don't have this special legislation. It only applies right now to Chemung, Monroe, Onondaga, and Tompkins County, and the city of Oswego, and then us.
And when does that run out?
That's permanent.
Okay.
Yeah. I mean, they should do this statewide, but the legislature doesn't want to do that, so that's why you've gotten all these little special cities added in there, and we just got it this year. We've been asked for it a long time ago, but
Yes,
it changed.
to Pat and John and they.
Yeah, actually goes back to McEnany, had it.
So, I'm kind of curious as to why the $5 fee for the marriage license you voted
That-
for, and
Well,
and you're distinguishing this.
I will say this, the men and women who have sacrificed for our country, we owe them a great amount of debt. And I've been saying it since day one from being on the council. When you look at what veterans go through when they come back from being on the battlefield, and the resources, the lack of resources that go towards them, it's horrific. And I believe that as legislators, we need to make sure that our bravest and the individuals who sacrifice for this country so we can enjoy the freedoms
So
that
you're
we
saying
and the liberty that we
this
enjoy.
is budget neutral?
Yes, it is.
Yeah.
It is budget neutral.
All right. Sorry I missed that. I thought I was, my car clock told me I was getting here on time. I did run into somebody who had to ask me a question out on the front street.
We actually waited till
Could you
5:30.
introduce legislation exempting military from this fee? Or is
So,
that state bound?
I
Maybe
do.
that'll make you happy.
When people are looking to enlist in the military and they need a copy of their birth certificate, we will waive the fee
Oh,
for
there you
them.
go.
So there are a lot of great services that we provide up in Vital Statistics that are pretty much unsung, that you wouldn't necessarily know. So we do support our community.
So there are certain
It's in the
areas where you're mandated, which cover a lot of the concerns I think that this would have. And then you also have the additional flexibility where there's a hardship case. And this applies to probably vast majority probably is non-City of Albany residents
That are coming and
that
making
have come in and
requests.
need it, whatever.
And you have that statistic, right? You said.
Yes, we do look at them, and for the most part, most of the people coming in requesting certified copies. Sometimes they don't even live in the state of New York anymore because they're submitting applications by mail or they're calling us.
So Danielle, I'm looking at the budget. So it is Vital Statistics that takes care of this function.
Birth and death records, yeah.
All right. Does anybody from the clerk's office take care of this?
Me.
So
And we
part of your
Put
salary.
these together here, yeah.
So part of your salary is associated with this. And then I would imagine there's some overhead you're allowed to include, cost of the heat of the building and that kind of thing. It's just that I'm looking at, decide to pull up the budget, and it does show department totals 210,945 for this, with revenues at 274. I actually, with that said, feel like the budget department needs to provide us with an assessment, the budget office, and
Is that the 2019 or you looking at the 2020?
I'm looking at 2020. Oh, actually, for some reason so it doesn't have anybody for the registrar. It has the deputy registrar.
Because part of what you may be seeing is the fact that there's no longer a specific salary associated with the registrar. Because as the city clerk and the registrar are now combined.
Right.
So that may be some of it.
Yeah, but we're taking this amount that's in the budget and then we're adding to it with this.
Yeah.
So while I thought that this was kind of a no-brainer, because I am surprised to see that our revenues are already over what the expenses are associated with that. Now again, you can do the overhead. This doesn't include retirement, etc. So, Richard, I know that you're having... I think you're kind of disappointed that I'm raising
I don't
this.
care. I mean,
So do we want to table this,
we'll just
or?
hold it. I do want to schedule another meeting at some point to take up the honorary street renaming. It's amusing because the prior council actually passed a resolution asking for this piece of legislation.
Which legislation?
The one we were just talking about.
To control the fees.
Yeah.
It's a new council, so.
Yeah, but we still,
But, you know-
don't you agree that we need to make sure that the fees the total revenue doesn't exceed the cost of
That's
providing
fine.
the service?
Then it will be a tax rather than fee. You don't want to increase taxes.
I don't know if the state meant it to be that way with vital records, because I kind of feel like the state wants the municipality to be able to generate revenue, because the state wrote in, because what would happen is if the municipalities didn't have copies, everybody would flood the New York State Department of Health, and they don't have the manpower or to keep up with all of the counties. So I think the state meant this to be a revenue generator for municipalities. And it's not, I mean, when we look at it versus our expenses, it's not a huge revenue generator when you look at some of the other departments.
Then we need Corporation Council to look at some of the case law and look at the language and tell us that we are allowed to charge more than what the cost of providing the service is.
So you want to schedule another meeting?
That's what the state legislation says.
So we're going to make a motion to table this until further
The state
discussion?
legislation says we can?
Oh, it just sets, the state legislation sets the charge.
So I'll make a motion to table, or you want to make a motion to table?
You can do it, and I'll
All right.
second it.
Well, I'll make a motion to table this
And
until
I'll
further
second it
discussion.
for now.
All right, thank you.
Yeah, I made a motion once before that was kind of, never mind, I won't get into that issue anymore.
I wasn't here.
No, I was talking about something else.
Yeah, I know. And I was telling Jack, I wasn't, the latest election was unanimous, but I was in the bathroom. So, and I didn't get to vote, so it wasn't unanimous. That's life.
Well, it technically was unanimous. You just weren't present.
Yeah, but maybe I would have voted
But
no.
if it's a 10-0 vote, it's no.
No, unanimous means
Unanimous is
everybody.
everybody.
No.
Majority, you
Because
got
there
the
could be
majority.
somebody absent.
Then it's unanimous who's here, but I was here. She had called my name out, and I said, be present. Oh,
It's still on, so
I'm sorry.
it's still being recorded.
Yeah, no,
I
better than choking you on TV.
I don't know when we want to do this. I wanted to start on the other ordinance, which is the...
About the name in the street?
Yeah,
And what about the ethics legislation?
that's going to require, I think, more time and whatever. Although I have seen things that just go through without any discussion. So, but I don't want
Is
to
that
pass,
ethical?
I don't want to pass a flawed piece of legislation like we have done in the past.
Richard.
What about Black Friday? That's an open day. Joke. Thanksgiving's so late this year.
I don't care, I mean, I
Are you
don't,
looking for an excuse to not have to do Black Friday? Get out of the house on Black Friday?
Yes.
So late.
is there any dates going through the 18th through the 25th that are good or bad
November?
in November?
Oh, yeah. I'm available anytime. So
Well, 18th is a council meeting.
Yeah, I wouldn't do it on that one.
I have a meeting on the
I just have a
20th.
question. This is being tabled for what? For further information on,
Yeah, or
just
maybe,
more,
maybe for good, I don't know.
I'm just wondering, just.
table it for
more
good.
information?
Yeah, we make a motion to table it for good. I mean,
To table it to get
You
more
can't,
information?
you can't table for good.
all right,
I
well,
wanna
we
be
could kill it in the
clear
committee.
that I'm
Just stuck in committee.
generally positively disposed
Yeah.
to this. And if I get reasonable information from the budget office showing what the actual costs are and a projection as to what the additional.
Well, I think that would come from the clerk, because I don't think the budget office is going to do that.
Well, can you get us that info?
I can't.
Well, I think that there's also, what is the reasonable overhead? Because unlike most of what we do and what we put in the budget, the cost of heating and rent and et cetera is something that you can, so usually like on federal contracts, it's like, I don't know, like
Yeah.
a third.
I don't know how involved the budget office is they've even been in discussing this, so that they're
No, and
aware of it, but they're not, really,
I
it's
don't
not
have
something that
to-
they've been focused on.
factor that in when I prepare a budget. I think they just look at the overall cost of heating and lighting City Hall, but not the drain that each particular department has.
Well, what I'm saying is basically what we're seeing in the budget right now on its face does not, the revenues already exceed the
cost.
budgeted costs. So where, the budgeted costs that are in vital statistics. So what proportion of your, we used to do this, we used to charge clinical laboratories, and there were lawsuits all over the kazoo about it, and eventually they gave up the whole program because of it. But they would have, this laboratory director over here is actually spending, 20% of their time helping do oversight for, so the allocation of the time is something that was mandated by the state budget office.
Yeah, but the clinical lab issue is also something I believe was done administratively by regulation. There was some authorization, but you basically had
The
the flexibility.
Whatever
authorization
time
was
works for
they
you.
could recoup the cost of the program.
But in this
I like
case,
the 20.
we're setting
Frankly,
a fee
I'm
set
open
in
on the
statute,
20.
but the state has set in statute.
20th of November?
Are we
Well,
done with this, or?
Yeah. So we'll
Yeah.
look at some
Do
of
we have
that.
a
schedule
copy
a
of the
meeting.
statute
The
here?
20th is the 20th?
How do you press that? Or-
That's a Wednesday.
I have the state, here, you can look it up, but here's the bill that passed, and you can go back and look.
Richard, the 20th, does that
The
work?
the 20th work for
The
me, too.
20th is, no, there's a housing meeting on the 20th. There is either the 21st.
I can't do the 21st.
Yeah, I can't do it.
There's the 25th, but I have to be out by 6:30.
Yeah, the 25th works for me.
The 26th, but I wouldn't go beyond that because that Thursday is Thanksgiving.
I could do the 25th.
Yeah, the 25th works for me.
But I have to, as I said, I
5
have to be out.
o'clock.
I can do it earlier.
I can get here at 5.
It's the same.
I got here today, 4:30. It was rough, but, yeah. And we're going to be dealing with just the naming of the
I just want
streets?
to want to start getting things out of the way. Because
As
there's
far
other
as-
stuff that's going to be coming
The
in.
naming of the streets? All right.
Yeah.
As far as this, I'm thinking, are we married to the $5? I mean, if we raised it $1, if it turns out,
That's change.
Yeah,
All right, so we'll try to get some information on the vital stat stuff.
okay.
I will look at the 25th, I have to check with Joe also. If we can do 25th, we'd say at 5 o'clock, you all?
yeah, I want 5.
Yeah.
You can do 5, Judy, you can do 5?
Who's arguing the size of these?
Yeah.
Maybe, or 5:15 maybe.
Yeah, well, I
will-
agree. I want to
I
know
just
where the
want
money
to
goes.
get that other thing out of the way.
It looks like it's $64,000 more.
So actually,
Could go to soccer.
So we're all
we
set?
didn't have a vote on the tabling of this. What this says is
We just,
the registrar shall be entitled to a fee.
I gotta go.
10.
Yeah, I mean, I have some